Good afternoon all, and thank you for joining us for another Secret Sunday session today. Today I'm joined by Crystal, and today we're going to be talking a lot about Crystal's practice in terms of gut health, IBS symptoms, and also what people can be looking at if they're finding that they're having issues with their gut. As you know, I don't have all the answers, so I have brought Crystal in. And to kick us off today, like always, Crystal, who are you and what is it that you are doing?
Sure. So I am an accredited practicing dietitian. I'm based on the Gold Coast in Queensland, and I work with people who have digestive disorders and conditions such as IBS. So anyone really struggling with things like bloating, pain, constipation, and diarrhea, I help them to improve those symptoms. So find symptom relief, find out if food is triggering any of those symptoms, and really help to expand their diet so they're not on long-term restrictive diets, or clear up some of that confusion around their diet.
Wow. And why did you decide to go into this practice?
I myself do have IBS. So I personally started getting symptoms as a teenager, and I felt quite dismissed by health professionals when I was younger. It was kind of just like, it's just constipation, or go eat some more fruit, like really quite dismissive comments. So I ended up not seeking help for a really long time, and kind of just even didn't tell my friends that I was going through it. And then coincidentally, I became a dietitian and then realized these two line up. I should, work in this field. And I think just because I do have personally know exactly what the symptoms are like. And I think when you don't have these symptoms, it's really hard to imagine, because particularly we'll talk about it in a bit, but when you have IBS, nothing comes up on a blood test, nothing comes up in a colonoscopy. So doctors are often like, oh, nothing's wrong. Whereas when you have IBS, you truly understand what that pain is like. So that's why I'm passionate about the area, because I think through diet and lifestyle, we can make such a huge difference to people's quality of life and through their symptoms. So yeah, that's how I'm here.
Awesome. And when you talk about IBS is not recognized in a blood test, or when you go and have a colonoscopy, then how is it recognized and how do you know that you have it?
IBS is diagnosed via a set of criteria. So the criteria is based on your symptoms. The gut symptoms can be a number of conditions. So usually the first step is seeing your doctor, and they do run medical tests, but the medical tests they're running are checking for other things. So they might be ruling out celiac disease or inflammatory bowel disease. And if the tests come back negative for those and your symptoms line up, that's usually when they say, it looks like IBS or it is IBS, then here's some treatment options for that.
Yeah, wow. Because I know as well, just talking about IBS and gut issues in today's environment, a lot of people do self-diagnose. Do you think that's recommended?
No, absolutely not. So self-diagnosis, it's dangerous because gut issues can be a number of things. Just because it sounds or feels like IBS to you, it could be celiac disease, which is a completely different treatment path, and it does physical damage to the body. So if if you're going down the wrong path for months or years at a time, it just prolongs, you're probably going to have symptoms for longer, prolongs the help that you actually need, and it can do physical damage to the body. So it doesn't matter who I speak to. If someone, sends me a DM on Instagram, or I talk to a friend about it, I'm always like, go see your doctor first. Let them know what you're struggling with. Make sure it isn't something more serious, and then we can treat it. Or we can do it at the same time. Just make sure that we're making those tests have been run. Because definitely do not self-diagnose. If that's one thing you get out of this talk, do not self-diagnose.
It's so weird. It's so common these days, I guess, with social media and the internet, and people just have access to so much content. And when they start reading all the signs and the symptoms, they just go, well, I have that. It's crazy the environment we're living in. But apart from all of that, what are the common signs and symptoms of IBS?
So the main symptoms come down to, it's all gut related. So it comes down to abdominal pain or cramping, bloating, excess gas, and then changes in bowel. So some people experience constipation, some people experience diarrhea, and some people experience both, the fluctuation between both. So yeah, that's what the symptoms come down to. Things like reflux or headaches or rashes. While it can be a sign of a different food intolerance, it's not related to IBS. So it's really focused on those lower gut symptoms.
Yeah, okay, wow. And then what is the treatment for IBS? Is it a long-term treatment? Is this something that you have to deal with for the rest of your life?
Kind of. So technically there's no cure for IBS. You can't heal IBS or anything like that, but you can manage it so it's not impacting your day-to-day life anymore. And you can make significant changes in that. Treatment's multifactorial. So we really look at lots of different things that's happening in your diet, in your lifestyle, and a number of strategies. I always talk about it like a puzzle. We're putting the puzzle pieces together for your personal body. So it might be things, it will include things like diet. So we look at lots of things in the diet. There's a diet called the Low Fodmap diet, which I know we'll talk about as well. That helps to pinpoint food triggers. There's just simple, like I do the foundational work with my clients. So we look at their regular meal patterns, how they're eating, their digestion, optimizing that digestion, mindful eating. So lots of things we can do in the diet to really support your body to do its job. Then there's psychotherapy. So like stress management, working with a psychologist. And there's also something called gut hypnotherapy. And then there's medications as well.
Yeah, because I have read a little bit about it, and it's not just about the gut, is it? It's also part of, you get distressed and anxious about it as well.
Yeah, so it's part of the gut brain. So the gut and the brain communicate, and we think, or they like, there's research suggesting that there's a miscommunication happening in the way our gut and brain communicate. So stress does have a really big impact on it, and working on that gut brain communication can help to improve symptoms as well. So it's a lot of different things, and I always say this to Instagram and my clients as well, but like, don't just go and cut out a bunch of foods, because it's not going to be the answer. We need to do things from all angles so that you get that true long-term relief.
Yeah, and what in your practice do you find there is a common reason why people get IBS?
No, there's lots of reasons. Again, we don't really understand it. The majority of it we don't understand. There is more research coming out in the area of what kind of drives it. So, for example, gut motility, or how fast food and things move through the gut. So people have slow motility, and that often causes constipation because everything's moving through quite slowly. Some people have fast motility, so everything moves through really fast, and that causes diarrhea. That gut-brain connection, so there's something going wrong in that gut-brain connection. Something that comes out of that is called visceral hypersensitivity. So visceral hypersensitivity is referring to how you perceive pain. So one thing that happens in IBS is like normal digestive function, so food moving through the gut, gas production, a bowel movement, and in kind of bowel contractions, that sends a signal up to the brain, and there's a miscommunication there, and the brain really interprets that incorrectly, I guess, and sends a signal back of pain. So these normal digestive processes is miscommunicated, and that's one of the reasons people feel pain. So there's lots of different reasons why it can happen. There's also an incidence, like increased incidence after food poisoning, or like traveling. A lot of people I see get traveling through Asia and they get sick, so kind of gastro. People develop post-infectious IBS, and sometimes that turns into long-term IBS as well.
Yeah, wow, it's so fascinating. Even I remember going through my eating disorder recovery and trying to figure out the mind to the gut connection, how powerful it is. Because when you go through eating disorder recovery, you really have a bad relationship with your body, and the gut normally follows quite poorly as well when you're giving yourself all different foods again. Do you find as well there is a disconnect with, I don't know if you've dealt with it much in your practice, but people with eating disorders and their gut health?
Hugely. So the majority of people who have experienced disordered eating or an eating disorder will have gut issues at the same time and for a while afterwards. And I think this is where that message is really important. It's not about cutting out foods, because if you've come from an eating disorder, you don't need to go on a restrictive diet. There's lots of other things you can do to help improve your symptoms and manage that, and cutting out foods is not the answer. But yeah, there's a huge link there, and vice versa. People often experience gut issues and then develop fear of food because they don't trust in their body, and they get in symptoms and blaming food a lot, which yeah, it's definitely tough.
For sure. If we look at the low FODMAP diet, is it a recent diet that's recommended for people with IBS, or has it been around for a while?
It's what I would call a newer diet. I believe it was first kind of termed in 2005. But as the years have gone on, more research has come out, more food products has come out, and more awareness. So I think the last maybe 2 or 3 years, it's really blown up, and it's the most well-known. It's not the only diet for IBS, but it's definitely the most well-known. So yeah, it's in its infancy. It's more known of. It's not the only option.
Yeah. And is it recommended for people with IBS?
Not blanketly. So similar, if you've got any disordered eating or eating disorder history, then it's not recommended. It really should be undertaken with the supportive dietitian who does a proper assessment first and sees if it is appropriate. And it's not first line either. So there's other first line therapies that we should do first, and then low FODMAP second line if those therapies don't work.
And what is the aim of the low FODMAP diet?
It's a 3-phase diet. So it's essentially a short-term elimination diet. The elimination period is 2 to 6 weeks, where the goal of that elimination period is to see if the diet works for you and if your symptoms reduce. They're probably not going to go down to 0 or to perfect, but we just want to see, does it work when followed consistently, and do your symptoms improve? That can happen within a matter of days. So if you're not seeing symptom relief by the 4-week mark, I always say, go back to your dietitian, check in with the dietitian to troubleshoot, and don't stay on the diet. If it's kind of worked or not worked at all, don't stay on it for months or years without, moving through. After the elimination phase, second phase is challenges. So we do some really structured food challenges to find if some of those foods trigger your symptoms and which ones don't. The amount of foods that people react to is quite different. So some clients, we might find 1 food trigger, some we might find none, and then others we might find maybe 3 or 4. So once we have that information, we move into phase 3 and really focus on reintroduction, variety, and really nourishing the gut bacteria as well.
Wow, it's a lengthy process.
Yeah, it's a process. It's a process, and I think that process is probably a better word than calling it a diet, because people hear diet and I think they have to follow it long term, or, they, like so many people come to me after doing the diet for years at a time or months and years and not really getting that success, where it's a short-term process and it's step-by-step and quite structured.
Yeah, phenomenal. It's amazing that there's even things out there though that can really help people that are struggling with those gut issues, because as you said, there's going initially to doctors and then dismissing you, it can be really challenging then to go, well, what now?
Yeah. I think there's lots of reasons why it happens. Like, I think the medical system, the doctors have such a short amount of time with you. They don't have enough time to do an assessment and make proper recommendations, but there's a missing link there. I think that a lot, like, there should be more referrals to dietitians, because doctors aren't trained in nutrition or in food, and they should refer on with someone that can spend that time really personalizing the diet and making these strategies, because there's definitely a missing step in there.
Do you think it's getting better around awareness and talking about things like IBS and referring people onto the specialists?
I think there is definitely more awareness with social media, particularly again the last couple of years. I think there's, like my account, and there's a lot more accounts that have popped up that are spreading awareness, providing support and providing information. At the same time, there's a lot of accounts providing misinformation and the wrong advice, which is frustrating, especially in gut health. There's just so much poor information out there. Yes, there's definitely more awareness happening, which is a good thing. More awareness means more support.
Amazing. Now I want to move a little bit into bloating, because I know, talking to a lot of just females in my field, they hate bloating, and I get it, it's uncomfortable, but a lot of people don't like it because the way that obviously your tummy bloats, and they don't like their tummy looking a certain size. But I feel like with everything, when you understand it, you can forgive it a little bit more. So what is bloating and why does it happen?
Bloating essentially it's either food in the gut, gas or air getting trapped in the gut, or more fluid in the gut. And what happens is some people will feel that as pressure, and some people will be physically distended, and you'll see it. So not everyone gets distension. It's normal, first off. So for a lot of people, I think that they panic over a small amount of bloating. Your body is supposed to change after a meal. It's supposed to change over the day. So choosing outfits that accompany that, and that, being aware of that, and just knowing that that's okay. Of course, if it's uncomfortable, it's affecting your quality of life, or if it's painful, then that's not normal. And there are lots of things that we can do. And what we can do is really addressing why it's happening. So is it that you're skipping meals all day and then eating a really large meal at the end of the day, and that's just putting a lot of pressure in the digestive system? Then we can do more regular meals throughout the day, or different strategies around that. If it's that you're drinking lots of soft drink throughout the day, and that soft drink's really carbonated, so all of those bubbles are getting trapped in the gut, can we swap that soft drink out for something else, or do, you know, change around that? FODMAP, the low FODMAP diet, helps with bloating because FODMAPs are fermented in the gut by the gut bacteria. It produces a lot of gas. It also pulls fluid into the gut, so that causes bloating for some people. So that's one strategy. But yeah, really it's fluid or gas or food getting trapped in the gut causing bloating. So we really just need to address why it's happening and making that assessment of, is it just normal bloating or is it something that is abnormal?
Is there short-term things to help with the discomfort of bloating?
Gentle movement, passing gas, like if it's gas, so basically farting or burping, gentle movement can help that. It can help you to release some of that gas. Deep breathing or diaphragmatic breathing can help to relax the digestive system and really switch on digestion and help that. There's some stuff around peppermint oil capsules or peppermint tea some people like. So peppermint oil capsules can help to reduce bloating. Mostly it's about relieving the built up pressure and the built up gas.
Yeah. No. And why do you think things like gas and things like poo and burping, why do you think it gets a bad rap? Because at the end of the day, it's necessary.
I think it's I want to blame the older generations. I think that younger generations are getting more okay with talking about it, but it used to be a big taboo topic for whatever reason. I don't know. But I think that it just used to be a taboo topic for whatever reason. And now we're getting more okay with talking about it, that it almost becomes second nature for myself, at least, because I talk about it all day. But yeah, I don't actually know why it originally was. Maybe because it's considered, you know, behind the scenes kind of thing that you just do by yourself and it smells and that kind of thing.
Yeah. And how often should we be going to the toilet and, you know, passing a stool?
The most important thing with how often you're going is consistency and your body. So some people going is 3 times a day. Other people is going once every 2 or 3 days. So that's that range. So once every 2 or 3 days to up to 3 times a day is what's considered normal. Most of my clients, we get it to about every day or twice a day, depending on their symptoms. And it's about, consistently doing what your body does regularly. And it's about what else comes along with that. So is it easy to pass? Is it comfortable? Are you feeling comfortable between bowel movements? Are you quite urgent and like need to run to the toilet? All of those are more signs that the consistency is off rather than the actual number of times that you're going.
Wow. And then looking at constipation and diarrhea, why would those two occur?
So many reasons. Constipation comes down to lots of things. With regular eating, enough fiber, enough fluid, enough exercise, motility, so if things are moving through quite slowly. Basically, if your poo is moving through your bowel slowly, the body reabsorbs water back into the body as that poo moves along. So it moves along the bowel, getting drier and harder to pass. So we want to keep it hydrated. We want to draw like fluid in there. We want to keep that bowel moving quicker so that it doesn't get so dry. There are other medical conditions, lots of medical conditions that can cause constipation. Pregnancy and hormones can cause constipation. Diarrhea comes down to, again, lots of different things. There's lots of medical conditions that can cause it. There's food intolerances that can cause it. There's fast motility, so everything's moving through quite quickly, so the water's not reabsorbed, which means it stays quite wet and quite urgent. That's the goal. The goal is to find out why it's happening. There's 50 different reasons why it's happening for you, what we can change in diet and lifestyle and medication or whatever you need to feel better, and how that plays out for your life.
Yeah. Now I want to talk a little bit about dairy. So dairy gets a really bad rap. I know in so many common conversations, people like, I can't have cheese, but I'll continue to have cheese, or, you know, I can't have dairy because of my food sensitivities. Is there a big issue? Does the body react not well with dairy? Is that why I'm finding so many people have a really bad relationship with dairy?
I think it's a layered question. I think that I'm not going to, I guess, say that it's not real, because people do have intolerances to dairy and their symptoms are real. I think that there's a lot of misinformation spread around dairy, and there are a lot of alternate health practitioners and accounts saying it is bad, you need to eliminate it flat out. Same with gluten. I always say, like, you don't need to cut out dairy and gluten. It's not the first step, and it's rarely the reason. More people have trouble with lactose than dairy itself. So dairy and actual dairy allergy is more rare. It's more common as a kid, but you would probably know about that before you're an adult. The lactose, which is the sugar component in milk, some people don't have the enzyme that break down lactose. So then lactose can cause digestive symptoms. Usually this is more like larger amounts of milk or ice cream or cream, whereas cheese and butter and small amount of other dairy products are well tolerated because the lactose levels are so low. Similar with anything, if you're eliminating something, we're doing it for a short period of time, and then we're doing some food challenges, because don't eliminate something and never go back to it. We want to know, when you take it out, do your symptoms improve? When we add it back in a small amount, a medium amount, a large amount, how much can you actually tolerate? And then we want to bring back in as much as possible, because you don't want to avoid it forever, or you end up cracking and eating a really large amount and making yourself sick.
Yeah, wow. And can people really grow out of intolerances? Like, I know that commonly a lot of young people do develop intolerances. Can they eventually grow out of them?
Yes. I think I've seen it, and I work with people to improve intolerances. Not for everyone, but some people can improve how much they can tolerate. Some people can completely grow out of intolerances. It's because particularly with IBS, it's so many factors are involved. So if at one point in your life you're really highly stressed, you're not sleeping much, like all these other things are happening, you might be more sensitive to foods in that point because your body is kind of hypervigilant. Whereas if all of those improve, you might find that you no longer are sensitive to all of those foods. So for my example, for myself, I did low FODMAP about 5 years ago, and I did have intolerances after doing that. But after changes in life and circumstances and routine and just time, I no longer have to avoid any foods, which is amazing. And I've done that with a lot of my clients as well. Things they think they can't react, they do react to, they're actually okay with. And there's also research to say, if the more you have it, the more likely you can build a tolerance to it. So that's another reason why we always say, don't just completely eliminate something. We want to add back in as much as possible and build on that over time so that you can start tolerating that again.
Wow, congratulations, by the way. That's phenomenal, knowing that now you can eat whatever you want, because I know it can be a very stressful process for so many people.
Yes, exactly. And I think that's one of the benefits of low FODMAP. It gives you, for me and for a lot of people, like, it gave me such immediate relief of something that I was struggling with for so long. And it gave me what I needed in that time. But it's not necessarily a long-term thing or something you have to do forever. It's what you need right now. We give you that symptom relief, and then we build on that and make that long-term plan.
Wow. And do you think stressing and getting anxious over, your gut issues, does that make matters worse?
Yeah. So you can stress yourself into thinking you have a food intolerance. If you go into eating a meal and you say, I'm going to react to this meal, like, I shouldn't be eating this, I can't eat this, but you eat it anyway in a stress state, you're probably going to get symptoms. You're probably not going to tolerate it. So any kind of stress around your symptoms or your diet, or thinking that you can't eat a food, is probably going to cause symptoms. So I think that's always important to remember. I know it's not as simple as like, don't stress or don't think about it, but being aware of that and putting a plan in place to support that. And same thing, going through the structured process, so you have clarity around exactly what triggers your symptoms, then it helps with that.
Yeah, for sure. Now, I want to talk a little bit about different scenarios, and if you could just offer your best advice for, say, a person in that situation. So if someone was experiencing gut issues and had no idea what was going on, what should they do first, and where should they go for help?
Firstly, go see your doctor. So really, if you're experiencing any kind of gut symptoms, go see a doctor. Record your symptoms beforehand. Write down your symptoms, write down how long it's happening, write down anything else on a piece of paper. So I always find, for myself and a lot of people, you get in the doctor and you get flustered and you forget they might rush you, or you might forget to say something. Write it down and say it to them, or even give them the piece of paper. Run through your symptoms and ask, what tests should I get done? And then really, I'll reach out to an IBS or a gut health dietitian to support you in process to figuring out what's triggering it.
Yeah. If a parent has a child that's experiencing really bad gut pain, or they're not eating certain things, or they're constipated, or they've got diarrhea, what should they do, and where should they seek help?
Yeah, similar, see their doctor that's aware of, like, that knows the child. And then I'd be getting a referral to a pediatric dietitian, because not just any dietitian is experienced with kids. So I myself don't work with kids. So yeah, getting someone that's actually experienced and knows how to help them. So very similar pathway.
Yeah, and someone that may be experiencing intolerances to certain foods and feel like that they're dealing with this for the rest of their life, what should they do, and what advice would you offer them?
It's going to sound really boring because I'm going to say the same. See your doctor. We want to know that your symptoms are not another medical condition, because if it's another medical, we want to know what we're dealing with. So see your doctor. At the same time you see your doctor, you can book in with the dietitian. It doesn't have to necessarily be one or the other if you're ready to get started, because I know sometimes booking in with a gastroenterologist and going down that process can take months. So you can do both at the same time, but see your doctor, get medical tests done, find a dietitian that's experienced in this area, because it is a specialty area. Not all dietitians are going to know, how to help you. And they'll be able to advise on what foods to cut out, if any, and what foods to add back in, and how to make that work.
Yeah. And is there any short-term relief for people with those gut issues?
Like, how quickly can people start to feel better?
Yeah,
or like,
and also just, yeah, if they're experiencing pain, for example, if they're stuck on a wait list and they can't get in for the next 2 weeks or 2 months, what can they do in the meantime?
Can't advise around, I guess, supplements and medications, because that's going to depend on the person. If you can get into a doctor, there are medications and supplements that might give you some pain relief or something a bit quicker. I really go back to the foundation. So are you going to staying up really late, or can you try and work on your sleep? Can you get some gentle movement in? Are you drinking enough water? Are you eating regular meals? So just focusing on those basics, because I think those are so often overlooked, and people think, yeah, I'm doing that. But when you actually sit down and make an assessment, you realize, okay, there's some gaps in there. So focus on those foundations, speak to the doctor, or even a pharmacist might be able to give you something off over the counter that would give you some relief. And yeah, that's where I would start.
Amazing. And is there any last tips or advice that you would give to someone that is sort of entering this new space and realizing that they've got gut issues, but there's so much information out there, so you don't know where to go? I guess, yeah, what offered advice would you give to someone that's entering this new space?
Be careful. There's a lot of information out there. Take it one step at a time and try not to change everything at once, because there's so many things that you will read and hear. So be careful and just read everything through a lens. Just, have your detective cap on. If it doesn't sound right, or if they're advising things like detox or heal your gut, or they're diagnosing you, if they're not a doctor and they're trying to diagnose you with a condition, just be careful of anyone doing that, or anyone selling you supplements. Yeah, put your detective cap on, take it slow, go through, read a lot, listen to a lot of people, follow different people on social media, but don't try and change everything at once, because it's so overwhelming. And then find people around you to support you. So whether that's your medical team, your family, your friends, like, let them know what's going on. Make sure you're not alone, because it can feel like you're the only person in the world going through this. But there are a lot of people out there that are also experiencing it.
And you don't have to deal with it forever. You're a perfect example.
You don't have to deal for it ever. It is something that can be managed, not necessarily healed, and it comes in waves, but it can definitely get a lot better. And just because one thing hasn't worked, like if you've tried the low FODMAP diet, you've tried something, don't give up. There are lots of things that we can do. It's just about pivoting and trying something different.
Amazing. Thank you so much. Where can people find you?
Mainly on Instagram. So my Instagram is at IBS Fodmap Dietitian. Send me a message. Let me know if you found this helpful. If you have any questions, I'm always in my DMs. And yeah, I also have my IBS Clarity program, and I have a new program coming out very soon. So if you do need that one-on-one support, then send me a direct message on Instagram and I can see if it's a good option for you.
Amazing. Thank you so much for jumping on today and starting the conversation with me, but also for everything that you're doing right now and helping other people, and also sharing that hope, that hope story yourself, knowing where you've come from and now being recovered from what you've experienced. It's amazing. And congratulations and everything. Once again, thank you so much.
Thank you so much for having me.
No, and thank you everyone else out there as well for joining us again today for another Secret Sunday session. I will catch you again next time, but have a great Sunday. We'll see you soon.